Causes of miscarriages. Why your belly no dey stay whenever you get pregnant. Do you like this content? Follow our page, share this video wodo. Subscribe to our page. You guys are not subscribing to support this page, and drop your prayer requests in the comment section. This is the most asked question. A lot of women, they are experiencing miscarriages, and this is exactly what we are going to be discussing according to our findings. But before we go into full, I want to put a disclaimer that myself, Tochi, I am not a medical practitioner. I am not a medical expert. I am a researcher who study and come here to impart knowledge on women trying to conceive. With this my explanation, if you have further questions, if you need help, if you need recommendation, prescription, please contact your physician, your healthcare provider, your fertility expert, your gynecologist. These people have the right. I only research and teach, and I am not here to mislead you. I am not here to deceive you, but rather I am here to impart knowledge. So I received series of questions. People are asking, Ma, why is it that anytime I become pregnant, I will miscarriages? What is the cause? What should we do? I went into research to find out why women are miscarrying their babies. You can as well go and conduct research. You can also ask your fertility experts. And what I am here to explain to you is my findings. What I find that could be the cause of you always losing your pregnancy. If you think this content is for you, sit down and watch. To start with, somebody may ask, what is even miscarriage? Miscarriage is the spontaneous loss of a pregnancy before the 20th week. A lot of people, in most cases, they will have miscarriage. They wouldn't know until when it is too late. So it is the spontaneous loss of your pregnancy before it gets to 20 weeks. That is why I always tell people, immediately you find out that you are pregnant, you need to take it easy. You need to avoid stress until after your first trimester. That is what the researchers said. Now let's look at some of the reasons or some of the things that is making you to lose your pregnancy. Let's look at the reasons or some of the things that could be responsible for your pregnancy's loss. The number one, according to research, says problem with the gene or chromosomes. Most miscarriages occur because the fetus isn't developing as expected. When the fetus, that is your baby, is not developing the way it should be, then you may miscarriage it. Chromosome problem that could lead to you miscarrying your baby, according to the research. Everything I'm saying here is based on the researches that I have conducted. Is what? Belated ovum. This occurs when no embryo forms. Most of you, I receive this kind of question. Some people will say they miss their monthly flow, but when they go to scan, the scan will detect belated ovum. This is as a result of chromosomal problem. Majority of you watching this video might have experienced something like this. One is intrauterine fetal dismiss. In this situation, an embryo forms but stops developing and dies before any symptom of pregnancy. So this kind of pregnancy, you might not even really know that you are pregnant. That is why I said a lot of people will have miscarriage. They will not even know until maybe later. Some will not even know. They will see that they didn't get pregnant at all. I don't know if you guys are getting me. So another thing that could cause miscarriage is maternal health condition such as uncontrolled diabetes, infection, hormonal problems, thyroid disorder. All these things are the things that can make you to have miscarriage. That is why I always encourage women You know, people do not like those that tells them the truth. I am here to tell you the truth. What I find that I cannot deceive you. I don't believe in fantasies, but people believe in fantasies, telling them things that is not real, things that will not come to pass, things that will not help them, instead of telling them the fact. I advise women, before you try to get pregnant, please always check your health, especially if you are 40. Starting from 35, make sure that your health condition is very good, is okay. That is why they regard pregnancy at 40 as a risk, because at this point a lot of women develop chromosomal problem, diabetes, a lot of health issue that could affect them. It's not literally mean that if you are 40, people should get this correct. A lot of women have women have this misconception. They think, oh, once I'm 40, I cannot become pregnant again. You see people shivering, thinking that if they clock 40, they can't become pregnant. No. If you are 40, you are healthy, and you haven't entered what is known as premenopausal, you can still become pregnant. But at this stage, this is when you develop chromosomal issues that could affect you. Not that they will prevent you from becoming pregnant, but your ability to carry this baby up to 9 months. So get note of that. If you are 35 and above, you want to become pregnant, go to series fertility test. Make sure that your health condition is good. It's a very good thing for you to be healthy. If you are healthy, you will carry a healthy pregnancy. But if you are not healthy, I believe you that 9 months, you are not going to find it easy. And most of them might end up giving birth to, abnormal children. So the best advice, which I am not allowed, which I'm not a medical expert, as a human or as a researcher, I will advise you to always check your health. Now somebody may ask, how can we prevent miscarriage? Now, before you start planning to get pregnant, this is where you will prevent this. That is where you will help yourself. You must make sure you undergo series of tests to check if you are okay, and also seek regular prenatal care. A lot of women are pregnant, they don't visit their gynecologist, they don't visit hospitals. Some of them don't even know what they are carrying. Except those of them, especially those of us coming from Africa, we only go to antenatal to go and check the gender. Maybe you are looking for a male child, that is the only when they go. They are not even going there to check the health of their baby, they are just going to check the gender. This is not good. Another one is avoid unknown miscarriage risk, such as smoking. If you are smoking, you should stop it. Drinking alcohol, stop it. And illicit drugs, all these things can lead to miscarriage. Take a daily multivitamins. Limit your caffeine intake. If you are pregnant and you are not taking your prenatals or any medication that is prescribed by your gynecologist, you are not doing yourself and your born child well. I believe you understand what I said here. So if you like this video and this content and this platform, this is an educational content. Here we'll come to learn, teach, interact. So follow our page, subscribe, put on your notification bell to all notifications so that anytime we post a video, you'll be the first one to check it. I will put a disclaimer again that myself, Tochi, I am not a medical expert. I'm not a medical practitioner. I am not a professional. I am a researcher, that woman that studies, and I come here to impart knowledge. Thank you for watching. I love you. Your health is my concern. Your ability to conceive is my concern. Thank you.